Hello. Okay, so today Dr. Lynch and I wanted to talk about a topic that's becoming increasingly important here in this country and actually around the world, and that is the topic of mental illness and substance abuse that's been associated with the pandemic and the stressors related to the pandemic. So first thing we're going to do is throw out a few stats at you. The first one is depression. And the increase in people reporting depression went from 11% between January and June of 2019 to 42% in December of 2020. And the source for that was the CDC. As far as anxiety, it's very similar. The journal Progress in Neuropsychopharmacology and Biological Psychiatry reported about a 3 times increase in anxiety from about 7.3% to about 22%. And then also 12% of people reported increases in alcohol consumption or substance use, and that was from the CDC in July of 2020. And you were looking at some of the local statistics, right?
Yeah, it's very concerning because, of course, we had similar increases locally. So anxiety and depression, from what I was finding, is about 3 times as much as we were seeing in 2019. Definitely worse in younger people. Drug use dramatically increased in terms of bad outcomes. So number of deaths related to overdose were much higher in 2020 than in 2019. We saw a 40% increase in drug overdose deaths in 2020 in El Paso County. Yep. Nationwide, drug overdose deaths increased by 30%. But it was higher here in El Paso County. Mm-hmm. The other thing I was finding, talking about youth, we always worry about suicide risk in our youth. It is the second leading cause of death in children, 10 to 17 years old. Mm-hmm. And this is nationwide, second leading cause of death. That's true here in El Paso County. And in 2020, we saw a 40% increase in suicides in 11 to 17-year-olds.
That's terrible.
Mm-hmm.
Yeah, and that was another thing that was one of the more fascinating statistics that I found when we were researching for this, which is that the prevalence of mental illness and substance abuse was higher in younger people, and so every age group that you saw, you could see a drop in the prevalence of the mental illness, despite the fact that the risk from COVID in those same age groups would be going exactly the opposite direction.
Right, and you're talking specifically about anxieties related to the pandemic, the lockdowns, the COVID experience, really, that it was inversely proportional.
Well, yeah, it was people who reported anxiety and depression.
Okay.
Right. Mm-hmm. Over 50% in like the young adult group, and then it was right around 25%, which is still high, but 25% in 65 and older.
Well, and I can tell you, I saw that in my practice with the young people, in particular our teens who were looking to get athletic scholarships. Mm-hmm. They were graduating. Some of them had scholarships to certain universities, and there was a lot of uncertainty about whether or not they would be able to do their launch plan as they had defined it, and a lot of them got derailed from that, and it was really hard to sort through.
Well, and a lot of them missed their last season of athletics. They missed their prom, they missed their graduation ceremony, and there were just a lot of stressors, and it was unfortunate because the risk was never really very high with that group of people. They just kind of bore a lot of the brunt of the stress from it. And on top of that, because of the pandemic shutting down access to mental health professionals, they couldn't get the care that they needed a lot of the time.
It was very challenging. Fortunately, the system responded, and we had a huge blossoming of telehealth services for mental health, and that's been really good to see that expansion, and I hope that continues because that can eliminate barriers to access, especially for young people. Mm-hmm. But then it can be hard sometimes to connect virtually.
Yeah, it's not quite the same.
It's
definitely better than nothing, I think.
Yeah.
But it's not quite the same as being in person. Mm-hmm. But fortunately, certainly people can come see us in the clinic, And
that's right.
Yeah, exactly. So if you are struggling with any of these issues or really anything else, definitely reach out to your healthcare professionals. Don't keep it a secret that you just deal with yourself. This is something that you can definitely get better. You can get better by doing things that help your general sense of well-being on your own at home. You can see a counselor or psychologist, and they can kind of help you with some of those tools as well. And then if necessary, you can even come talk with one of us. We can discuss whether or not maybe a medication would be helpful for you to help at least get you over some of the symptoms that you're having right now currently. And even in really, really severe cases, we can refer out to a specialist, like a psychiatrist.
Absolutely.
Yeah. So anyway, we just thought it was important to discuss this, and because it's been so prevalent, and I've seen it in a lot of my patients as well, and obviously the statistics kind of are backing up what we've seen.
Yeah, and it's not a great place to start heading into the holidays. Holidays can be so wonderful for so many people and super stressful and depressing for others. It really depends. And so I always find myself on high alert as we head into the holidays in terms of screening and working with some of my patients. It can be such a challenging time. And so I would love for you to talk about what you've been doing with the Health Confidence Academy to give our patients a set of tools as they head into the holidays.
Right. Yes. Okay. So the Health Confidence Academy website, what I've been working on with my colleagues here is a program that discusses those measures that you can take on your own that help you deal with the different struggles in your life, including mental health. So it's very basic things that actually matter a whole lot. Things like fixing your sleep schedule, eating healthy, getting some exercise in, making connections with other people, especially people who are close to you, keeping a gratitude journal, things like that. All of these little things that have been proven to actually help with mood. They help with depression. They help with anxiety. So it's the idea behind that program is for people who don't have either the means or the access to see a counselor, they can at least get the very basics of these measures that you can do, including the very beginnings of cognitive behavioral therapy. So that's the idea behind that program, which is going to be coming out during holiday season. We set it up specifically for that, so it would come out during holiday season, which is when we see the most mental health issues.
Well, and I think it's a basic toolkit that everyone needs to acquire.
Oh, no question.
Because you never know at what point in your life you're going to need to reach into that toolkit and start focusing on the things that you're grateful for, to meditate, to get help when you need it, and to just really utilize those tools. That's it's a great set for enhancing your coping skills, and life can be hard and very unexpected. So.
Yeah. For even if your life isn't hard right now, there's going to be some point in your life that is hard. So it's nice to have those tools in the tool bag. And in general, I mean, even if you're not doing that bad, these are things that can help pretty much anybody. So very, very simple, basic things that actually make a world of difference.
So it can help you to support others.
Oh my gosh, yeah.
Because we all have people in our lives that are struggling, and being able to support them is
actually, believe it or not,
phenomenally important.
That's one of the key things. And interesting that taking the time to help somebody else actually helps you. That's one of the main things that we do. Yeah.
Love it.
Pretty interesting. So anyway, that's what we wanted to talk with you about today. Thank you very much. Appreciate you.
Thank you.
Joining me for the discussion. We'll talk to you later.